medications as prescribed has been identified as a significant problem in HIV and AIDS management, resulting in viral suppression failure. Good day, listener, and welcome back to DDM Copies of the on our program, Your Home, Your World. As usual, you know, for remind you guys to subscribe to our YouTube channel, that the Diaspora Tamia, so you get the latest on house. So, what's to have stake? The President of Albinos Association of Nigeria, AAA, Dr. Bisi Bamishi, has urged government and stakeholders to implement skin screening and treatment into the national health insurance care. Bamishi made the call in her address of welcome at the event to celebrate the International Albinism Awareness Day in Abuja. The celebration with the theme IAAD 2025, Demanding Our Rights, Protect Our Skin, Preserves Our Lives, is organized by AAA. She described the theme as a powerful call for urgent action, adding as including skin screening and treatments into NHIS will go a long way to address challenges facing persons with albinism. The theme highlights the critical need to raise awareness about the several health challenges, especially with skin cancer, which disproportionately affect our community as a whole. It is a reminder to governments, civil society, the media, and the public as a whole that we must not be left behind in healthcare, protection, empowerment, and inclusion. One of the most pressing challenges is the harsh environmental conditions, which have led the rising cases of skin cancer among our members. Many cannot afford treatments, yes, and as a result, we are losing lives daily. So we passionately appeal to the government, stakeholders, and every concerned person to suffer the integration of skin screening and treatment into the NHIS. This intervention will save lives and offer hope to many. Of course. She further noted that students with albinism are facing educational disadvantages due to visual impairments and urged relevant authorities to ensure the full implementation of the National Albinism Policy on Education, with prompt and adequate provision of necessary learning aids to facilitate inclusive and quality education. Many this year's celebration renew our shared commitment to upholding the right and dignity of persons with albinism in Nigeria. Let us inspire border advocacy, inclusive policies, and sustained investment in our health, education, and well-being. Above all, let us remind us and the world that we are worthy, strong, and resilient, the statement said. She narrated the achievements of the association within the last 2 years to include expansions of AAA state chapters to 26, with plans on the way to establish chapters in remaining states. Others are registration with Journal PWD, OPDs, NCPW, and other NDA. Growing recognition, inflation, and so many in the project update. We have also strengthened relationships with the critical stakeholders, laying foundation for meaningful social integration, she stated. Also speaking, the chairman of Board of Trustees of AAA, Professor Sam Amadi, said the association had a good structure, gaining more recognition and doing more. He stated, when we are united, we can articulate our needs upwards. Our strength should lie in our unity of purpose. There are reforms going on, but there are gaps we need to do more in advocacy, especially teaching in schools. We are on track, and by God's grace, we will achieve our purpose, Amadi stated. Contributing to that too, Chairman Joint National Association of Persons with Disability, Mr. Kaura Wakili, SCT chapter, said persons with albinism face unique challenges. He commended them for showing remarkable strength and resilience, and assured them of sustained solidarity. We must continue to push for better health care, equal opportunities in education, employment, and protection from all forms of discrimination. So lovely. Let's work together to build a Nigeria where no one is left behind. I think that will be the verse. Similarly, a stakeholder, Mr. Afam Kasim, called on persons with ability to learn how to protect themselves from sun ray to avoid skin cancer, which is their major challenge. That is their major challenge. Also, use sunscreen. If the federal government is supporting us, we should also protect ourselves. Yeah, you can't just expect protection from the government while you're not protecting yourself. You have to take good care of your skin. If you're an albinism person, please avoid the sun rays. Yes, if we keep flouting our skin to the sun, definitely we'll have issues. So, no matter the condition, protect yourself first. Then the government comes in. Well, also, the news agency of Nigeria reports that the events attracted stakeholders from the public. You can imagine, and also private sectors and executives of AAN from different states. Wow, so wonderful. So many people contributed in the progress of those living with albinism. So please also add more if you are opportune to do such. Next, the national chairman of the Coalitions of Healthcare Professionals in Tertiary Education Institutions in Nigeria, Musa Shehu, has lamented that many health workers who contracted COVID-19 while on duty were abandoned by their respective management during the payment of allowances. So sad. Shehu, who decried the poor remuneration of health workers in the country's tertiary institution, said health professionals in universities, polytechnics, and college of education were not being treated fairly. According to him, the health workers rendered essential services during the pandemic on the directive of federal governments, but were excluded from the COVID-19 hazard allowance. Speaking with our correspondent on Friday, Shehu said, many health workers working in these universities, polytechnics, and college of education medical centers came down with COVID-19 virus while carrying out their duties. When the federal government started paying COVID-19 allowances, health workers in the universities, polytechnic, and college of education's medical center were denied. So sad. Their management did not make any effort to sensitize the federal government to the awareness of these federal health workers who worked actively during the COVID-19 period. However, the unions within these tertiary education institutions kept their distance and refused to have anything to do with health workers as they share different salary structure from the health workers. So sad. He added that 99% of health workers at tertiary institution medical center across the country were being deliberately unpaid by their management. Works a wicked word. In a statement provided to our correspondent, Shehu said the affected workers had endured systemic marginalization and neglect for years, forcing many to abandon their jobs and migrate to Europe and the Middle East to search on better working conditions. No wonder they jabber every time. According to him, the management of these institutions, through their treasury departments, removed critical allowances embedded in the commerce and conher salary structure approved by the federal government. These allowances include teaching specialists, uniform, medical hazard, shifts, and call duty permit. Mobilization and operation by the magistrates of these universities, polytechnics, and college of education medical centers are pushing these health workers to Europe as the victimization, oppression, and marginalization manifest in the form of deliberate underpayment of health workers to hijacking of their career progression, which further frustrates them. These are salary structures created by the federal government for all doctors and all health workers within Nigeria. So why are they being denied? Teaching specialists, uniform, medical hazard, shifts, and call duty allowances are taken away from the salary. You can imagine. Well, she will not say that beyond salary-related issues, health workers are also denied the rightful promotions, placed on incorrect salary levels, or left on the same grade level for years, contrary to the federal government's approved scheme of survey. You can imagine. People that allege that some health workers are threatened or harassed by security agents for speaking out against this injustice. This is really hurtful. Shehu also accused unions within the institution, which operates under a separate salary framework, of either distancing themselves from the house workers or colluding with management to suppress their welfare demands. He raised concern about the outstanding 36 months of unpaid medical hazard allowance areas, which he said remain unsettled due to management's reluctance to push for a release of the poor. Shehu also stated that other statutory allowances such as teaching, uniform, ruler, and responsibility allowances are regularly withheld, worsening the restrictions of the health workforce. However, describing the situation as a national emergency, he called on the federal government to intervene and halt the continued loss of skilled professionals from the country's healthcare system. No wonder we keep on losing our health workers each day. We consulted for a response. The spokesperson for the Federal Ministry of Health, Alaba Balogun, asked our correspondent to send the inquiry via WhatsApp. But since then, according to Shemo, that as of the time of filling this report, messages sent to him had not been responded to. Honestly, this is so sad. You can imagine our health workers leaving the country due to injustice. It is very, very sad. Honestly speaking, the government has to come in this so as to make peace normalize. We don't want our workers to leave the country. We want to keep on having them every day. Well, with this, we come to the conclusion of our news today on your health, your wealth. Please do ensure to click on the like button, share, comments, and subscribe to our YouTube channel, that is Diaspora Digital Media, so you get the latest on health. Until I come your way, I am Nenero Michael Nezine. Do have a lovely day. Thanks for watching. Bye for now. Billionaire philanthropist Bill Gates and Nigerian business magnate Aliko Dangote have emphasized the importance of innovation and partnership in driving health. In collaboration with Ugweide Joma Wokoma donated sanitary pads to over 500 students in Cooperative College in Ohaji, Ebwema local government area of Imo State. Their medications as prescribed has been identified as a significant problem in HIV and AIDS management, resulting in viral suppression failure, drug